Welcome to a dialogue on diversity, equity, and inclusion in academic medicine, with a particular focus on underserved communities in Black America in honor of Black History Month. I'm Tom Carmichael, Chair of Neurology at UCLA, and I'm honored to be joined by Dr. Jennifer Adrissi, an Assistant Professor in the Department of Neurology at UCLA. Dr. Adrissi?
Hi, thank you so much for having me, Tom. Again, I'm Jennifer Adrissi. I am in the Department of Neurology, Division of Movement Disorders, and I'm also a health services researcher. So a lot of my research deals with how to increase equity in the Black community as it relates to neurological disorders, specifically Parkinson's disease, and how we partner with the community to create effective and sustainable interventions. I'm the director and founder of the Parkinson's Core Collaborative, which is an academic community alliance really trying to partner with the community to find solutions.
Thank you, Jennifer. So you are indeed an expert and have really been involved in community-partnered research.
Yeah. I am trying to move towards expert, but I think we're all learning. And so I'm learning a lot from the community and really value my time in partnerships with them. Yeah.
Great. Well, the first question is, what are some of the obstacles that you've seen in extending academic medicine, clinical care, and clinical research into underserved communities like the Black community in Los Angeles or your previous work in Chicago?
Yeah, definitely. So I think a lot of the barriers and obstacles in neurology are just an extension of general medicine and medical care and the barriers there, which, the background, a lot of systemic racism basically creates this structure and social determinants of health that have created barriers for certain communities, including the Black community. And so this affects where people live, right? What they eat, what healthcare resources they have access to versus which ones they don't. And so for us at UCLA, we're in a particular interesting spot, right? Because we're in Westwood, right? So even geographically, who's able to get here, who's not, who has the insurance to get here, who doesn't. And then thinking more specifically in neurology, we're subspecialists oftentimes. And so there's many steps or hurdles in order to even get here, right? Whether it's a referral from a primary care doctor, if they even have a primary care doctor, what is that threshold for actually seeking medical care? What are the resources that they need in order to get to a Tuesday at 9:30 a.m. appointment? And that's even before you're talking about more specialized treatments, research opportunities, things like that. And so a lot of these barriers and obstacles have led to disparities in the Black community and other marginalized communities. Everything from underdiagnosis of neurological disorders. I specialize mostly in Parkinson's disease, and so underdiagnosis, under referral, under treatment, and a lot of my research is in underrepresentation in clinical trials and research in Parkinson's disease. And that's really the top of the ladder once you've gone through all of these other barriers and hurdles. And so I think that in general, there's multiple steps, multiple barriers. And I think the next step is really, where do we start? Where does the responsibility fall? How do we share the responsibility and the accountability in order to really make steps forward?
These are difficult problems. Yeah. You're describing this deep historic legacy, this systemic process in place now that further limits things, and yet a need to have a connection, exactly. A personal health care, an emotional connection on all those levels. And your work has specifically tried to address that. How do we form connection? Exactly. How do we form partnership? Can you tell us a little bit about your strategies to overcome these obstacles?
Yeah, definitely. And I think the underlying foundation of my research thesis or career thesis is really how do you use community building and community partnerships to create solutions, right? I think what happens right now is a lot of our outreach is disconnected from care, right? It's disconnected from the research. And so how do you put all of those things together? I think historically what we've done is when there's an event, right? Like COVID, right? The pandemic, we have certain programs that we go out and we try to partner with the community to solve a problem, and then we go away, right? Or when it comes to research, there comes a grant, and then we put together a program partner with people, and then we go away. And so I think one of my main things is how do you create sustainable long-term connections with the community so you're not recreating the wheel each time, right? And so in doing so, you're creating trust, you're creating the partnerships, you're learning both ways. And then out of that, you create your projects, you create your different access points and increase resources, clinical resources, research resources, whatever, into the community over time. And so what my research has really done is created that longitudinal hub, if you will, that we're able to flow resources in and flow information out and right? And so with the Parkinson's Core Collaborative, I started a little bit under a year ago. So CORE is actually an acronym. And so it stands for Community Building, Outreach, Research, and Education. So those are our pillars and what all of our activities fall under. And so what we started off with was really just going into the community, seeing what they need, being at tabling events, helping out at their events, and seeing how we can give before we ask. And so with that now, they know us, we know them. And so we're able to start figuring out what are some of the gaps, what are their needs. And some of them are very just tangible. Like, we don't know, like, who do I contact to even get into the neurology department? You know, what do I do? That could be one. It could be some just social support. You know, what are those resources? A lot of those times we as physicians have no idea, right? Yeah. And we're often understaffed as far as social workers and other support staff to kind of help us with that. And so trying to put those things together, and then in creating those relationships, we also bring up discussions of, you know, what does a specialized neurologist look like? What is movement disorders, right? Like, people are like, Parkinson's, movement disorders, what's the difference? It's the same. And then we talk about research as well. And so just having these long-term connections, and very real, true, genuine connections first, has been very helpful. And so out of that, I've had multiple projects that we're starting up now.
Dr. Adrissi, how do efforts that make research more diverse also impact patient care and perhaps make it more inclusive?
Yeah, definitely. So the research, especially community-based and partnered research, it really just gives us more information on how to treat patients and how to treat them more equitably and learn more about them, right? And so specifically, my area of research is Parkinson's disease. And so not just in Parkinson's disease, but also in other neurological conditions, a lot of our care is becoming quite tailored, right? Precision medicine, very genetically based medicine. And for the people who's, are not involved in the research, so Black people, for example, make up less than 2% of Parkinson's disease clinical trial participants, right? So as we're learning more about these genes and these mutations that we can target, we're not sure, right, if these are generalizable to the Black community. And so that's one thing, right? As we're learning more we're making our research more inclusive. And for me, my research is really looking at really the science of recruitment and how do you make recruitment more equitable and sustainable methods. And so as we're learning more about them, we're able to learn more about the management, the treatment, making those options more equitable. Another thing about learning about the science of recruitment for research is you're plugging them in, right, to tertiary centers. Mm-hmm. And so by connecting research, and a lot of the research that I do, some of it starts as surveys, interviews, right, questionnaires, and may eventually be adding more biospecimens, things like that. But by learning just how to connect people in different ways, whether it's bringing resources to them, making things easier, right, figuring out what are these barriers to get here for research, you're also learning what are these barriers that get here for specialized care, such as PD or any other neurological disorder, or even more broadly in medicine. So I think it all kind of informs each other. And really the main thing of it is asking the community, right? Talking to them. I think we don't do that enough. We kind of put together our hypotheses and put together a program or an intervention that we think will work, and then we just carry it out, right? And so I think the more that we can really incorporate the voices of the community, whether it's through community advisory boards or these kind of just longitudinal partnerships, really having some of the physicians also in the community, right? And see what that looks like tangibly. Some of the leadership, right, at UCLA, because some of these are bigger questions, right? Where you're talking insurance, when you're talking about where the UCLA facilities are in the LA County community. And so just kind of thinking through ways that we can put steps and kind of tangible direction to these more broad initiatives to make our department and our hospital more inclusive, more equitable.
That's really a lot of work.
It is a lot of work.
Yeah, and your view is very forward-looking, very aspirational, taking into account the devastating impacts of the past and the current situation. So it's really heartening to hear this.
Yeah, and I think that it definitely is hard work, and it's a big thing, right? And I think historically what has sometimes happened is that it just seems so big that people are like, where do we start? Yeah. Where do we tackle it? But what I always say is, like, let's tackle it as a scientific question, how we do with anything. Finding your specific piece of the problem, which seems so big, whether it's an iceberg type of analogy, and then figure out, okay, this is my slice of it. How am I going to tackle it? For me, it's Parkinson's disease in the Black community. How do I partner with the community to find systems and interventions to increase access to specialized care and research enrollment in PD? And so that's my little sliver. And so I think just trying to figure out what everyone's different sliver is and what are the levels of accountability and what do the systems look like. I think that we can start making small, steps towards the bigger goal. I think that's really the next step, is to go from kind of larger, broader initiatives to actually what are the logistical steps forward? What are the resources that are needed at different levels in order to achieve these steps and these long and short-term goals? But I think we'll get there. Progress is coming. I think that there is hope. We just have to plan and strategize in a very tangible way.
Well, thank you. This has been a great conversation. It's nice to end on hope, trust, connection. It gives us a sense of moving forward. This has been a great dialogue. Thank you for joining us, and work with us. We seek your engagement as we move forward to solve these problems.
Definitely. Thanks for having me.
Thank you.